knock on the door, walk in, close the door, provide patient privacy. Gonna wash my hands. I'm gonna introduce myself. Hi, I'm Alana Delgado. I'm your student nurse. I'm gonna be doing your trach suctioning care today. Before I even do anything, I'm gonna see if they need it. So I'm gonna assess their respirations. And actually, I'm gonna verify the patient first before I do that. Make sure it's the right patient. So we're gonna go to physician's orders. So we have Bernie pain, 9/23/1981, allergic to penicillin and sulfa. So I'll either ask him, and I'll ask him for his allergy to the name. If he can't reply, I would compare it to his wristband. So that is comparable. Now I'm gonna compare the physician's orders to the TAR. So we have Bernie pain, 9/23/1981, and then we're gonna compare it to the TAR. We have Bernie pain, 9/23/1981. And then we have tracheostomy suction and care as needed PRN with 0.9 sodium chloride. And then the physician's orders. We have tracheostomy suction and care with 0.9 normal saline. Okay. So that, we checked that, washed hands, verified patient. Now I'm gonna assess the patient's breathing, respiratory rate, saturation, oxygen saturation, and respiration depth. So it does look like he does need suctioning. So we're gonna prepare the patient. So I'm gonna put a towel. I will remove the pillow. I'll adjust the patient to working height. Now I'm gonna put on my gloves. I'm gonna check the suctioning equipment. Okay. The wall suction should be 100 to 120 meters of mercury, and the portable should be 10 to 15 meters of mercury. So I'll turn it on, make sure it's suctioning, everything's good. So now I'm gonna take my gloves off and throw them away. Now I'm gonna do my one check for my normal saline with my TAR. So we have normal saline, dose is as much as needed, time is now, individual is Bernie pain, route is via trach, medication is 0.9 normal saline, and reason is to clear airway, to help clear airway for the suction. Alright, so we've done that. Now I can open my, an expiration date. Well, I check for expiration date, and I would change the bottle according to facility policy. It's not expired. So I open my, I'm gonna move my sterile gloves. Gonna lip the solution. I'll put my hand over the label. So I'll lip the solution above waist, and then I'm gonna put just as much as needed in the container. Now we're done with that. Now I'm gonna put my sterile gloves on. I can find the hole. And adjust it. Alright, now I'm gonna use my non-dominant hand for the sterile hand. No. I'm gonna use my dominant hand as my sterile hand and my non-dominant hand as my clean hand. I'm gonna grab this. Right now I'm still sterile, so I can grab this. I would connect it to the suctioning tube. I would re-suction. I would lubricate the tube. Before I insert it, I would hyperventilate the patient. I can either use the resuction bag or ask the patient to take 3 to 6 deep breaths, or we can use the sigh mechanism ventilator. So I will insert in a circular motion. I only suction on the way out. I only want to keep each suction for 10 to 15 seconds. And I want to wait 30 seconds to a minute between each suction. I do not want to suction more than 3 times a session. So I'm going to go 6 to 8 inches or until I hit resistance. So I'm going to go down 6 to 8 inches until I hit resistance or until he starts coughing. And I'm going to go up. I'm not suctioning yet. And then I'm going to go up in a circular motion out and suction on, do the intermittent suction on the way out only. I would reassess the patient's respiratory rate. If his airway is cleared, I do not need to do another suction. I would clear the catheter, resuction. I would discard my gloves, put the patient in a comfortable position, document, wash my hands, and that's it.